Hi everyone, and welcome to another MedGeek TV Health Tip Tuesday. I'm Deborahlise, and so my fellow MedGeeks, I wanted to talk today about ozone. This is something I've been using a lot with my clients. I'm super jazzed on this. Of course, it's been around a long time, like everything that I talk about and share. But ozone, what I have discovered is as I'm breaking up chronic infections in myself and in clients, what we call biofilms, a lot of times when you do this with herbs, you're going to have something called die-off, where you just feel yucky and you feel worse than ever. But for whatever reason, with ozone, you really don't have that. And so ozone obviously is O3 and oxygen is O2. And so when you do ozone, the molecule of the ozone, the one molecule, will break up the infection, turn it into a protein, your body absorbs it, and you're left with oxygen. So the thing with ozone is you need to be very careful. I use ozonated olive oil, and I brought the one that I have, so it really looks kind of gray. This is olive oil, and this is just one product. It smells like ozone. Ozone has this smell of like right after it rains, and the thing with this is when it's run through olive oil, it's safer. And so the olive oil dilutes the ozone, and so then it can be applied to your skin. I've seen with fungal infections, it's pretty amazing. People who have sinus stuff, they can put the ozone up their nose, or I have been. I should just say that. I've been doing this. A lot of biological dentists use ozone, and they will run it through olive oil because that's how it's the safest. And it's like an oxygen tank, and they run it through the olive oil, and they will do dental procedures while the person is having obviously ozone that's been run through olive oil into the nostrils, and then it clears up any infection that could be happening in the mouth, helps prevent infections after procedure. It's pretty phenomenal. And I know, years ago when I had a practice in New Mexico, a lot of people who had environmental illness would take an ozonator and put it in their car, and it would pick up all the chemicals in the car and break them up, or put it in their house. But you have to be really careful with that because you don't want to breathe in straight ozone. It's really hard on the lung tissue. And so when people would ozonate their house or their car to break up all those carcinogenic chemicals and drop them down, it takes away all the smells of like new carpet. You have to run it, ozonator, and not be in the house. And then you open everything up and you let it air out for hours, if not a whole day, just to clear it all out. So straight ozone, not a good idea. But doing it in olive oil is pretty amazing. And now we're experimenting, myself and clients on, whether ozone can be used rectally or vaginally, like any type of infections that are there. Some people are putting it on their gums, in their nostrils, like I said. Really, really good for allergies, really good for inflammation deep in the sinuses. And it's incredible. I know when I've used it and I put ozone into my nostril, it warms it up. You can feel the little tingling, and then it just dissipates. And I have seen it work really well with really deep chronic infections like Lyme. I have some clients that will go to a practitioner who does ozone therapy, whether it's ozone injections, whether it's ozone sinus, what they call insufflation, and it's really helping break up biofilms from like very difficult to treat chronic disease. So anyways, it's super fascinating. I'm really jazzed on ozone, and I know it's available online. I would recommend you work with somebody, a practitioner, to utilize it properly. This is not me saying, hey, go do this. I am just educating you on what's out there and what I've been doing. So anyway, I hope you have a wonderful day, and just remember that there's lots of options out there, and you deserve deserve health. You deserve to feel fabulous. I'll see you next time.